Not having a specialist when you need it, doesn't matter if you're a Democrat or Republican, you're somebody in need.
If you ask U.S. Senator John Boozman, having a doctor at your disposal is a bipartisan issue.
Thank you all for being here.
But even so, some kinds of care may be hard to come by in the natural state. Boozman attributes this to Arkansas having a difficult time retaining primary and specialized physicians who are trained right here.
The problem is that once they get through with their basic training, they have to do a residency program, and we don't have enough slots.
Thus driving medical school graduates to further their education elsewhere.
About 40–50% of them are going outside the state, and then it's hard to get them back.
And that's really not acceptable to a part of the state that's growing as rapidly as Northwest Arkansas is.
Chancellor Cam Patterson with the University of Arkansas for Medical Sciences says to keep med school grads here, it boils down to two things.
We need funding for support of more residency positions, but we also need the experiential training for these positions.
This is why U.S. Senator John Boozman introduced the Resident Physician Shortage Reduction Act.
Some specific steps that we need to do both through Congress and then as a state to address that problem. It's not only in Northwest Arkansas, it's throughout the state.
If passed, the bill would lift the federal cap imposed by the Balanced Budget Act of 1997, which limits the number of Medicare-funded residencies, ultimately growing the available positions.
It actually introduces 3,000 more slots per year for 4 or 5 years.
With the main goal of raising the number of slots by 15,000 nationwide to increase a med school grad's access to experience while also increasing the chances they'll stay here in the natural state.
With the help of the government, we can introduce more slots and thus retain more of the people that we're training.